Hello and welcome to the Multicultural Media online conference hosted by the Ministry of Health, Multicultural Health Communication Service with Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for today. Thank you for joining us. We have, of course, as always, Dr. Jan Fizzell, Senior Medical Advisor of New South Wales Health, joining us, and she's online with us today. Hi, Dr. Jan.
G'day, Jess.
And we're so happy to have with us again Dr. Jeremy McAnulty, Executive Director of Health Protection New South Wales, to provide important information on measles and meningococcal, as well as Japanese encephalitis virus. Welcome, Dr. Jeremy McAnulty. It's wonderful to always have you with us.
Thanks for having me, Jess.
Thank you. And we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. For Dr. Jeremy and myself, we are meeting from the land of the Camaragal people of the Eora Nation. We pay also respect to elders past and present, and also leaders of multicultural communities represented in this forum. As always, we'd like to thank you for keeping your microphones on mute as we talk about all the issues on health matters for today. And please put your questions on the chat, and we'll also be putting some links to the resources in languages for your use on your publications and to share with your community. We shall start. Dr. Jan, what are the updates for COVID-19 and flu for today?
So people may well have noticed that we've had a change in how we are reporting COVID numbers in New South Wales. We've moved to weekly reporting as opposed to reporting things daily. So up to the 15th of September, at that time we had 1,290 people in hospital. We had 29 people in ICU, and we had sadly lost 115 people in the last week that had been reported to New South Wales Health. We had a total of 17,229 cases, which was promising because the previous week we'd had 21,711 cases. People may also have noticed that there'll be some changes to mask wearing rules as of next week. But the key thing is for people to remember that wearing a mask indoors, particularly if you're in a circumstance where you're around a lot of people, can still help prevent COVID because it is still out there in the community. Thanks.
Thank you so much, Dr. Jan. And Dr. Jeremy, it's as I said, it's wonderful to have you here with us. There are some cases on measles and some updates on meningococcal as well.
Yeah, thanks, Jess. So with winter and early spring, we tend to see rises in meningococcal disease in New South Wales and other parts of Australia. Meningococcal disease, many people will have heard of. It's quite a frightening disease. It's a sudden onset. It's an infection by meningococcal bacteria that people can carry in their throats and then pass on to other people. Luckily, it's quite uncommon these days thanks to vaccination, but when it does occur, it can be quite frightening. People get sudden onset of fever, often headache and neck stiffness, and when you look at bright eyes, it really hurts. You get nausea and vomiting, and some people get a rash that spreads over the body but looks purpley and red spots that sometimes join together. But all these symptoms don't occur at once, and so if you or your child gets these symptoms or you're worried, contact your doctor right away, because there are special antibiotics that can be given that help, can be life-saving. So it's an uncommon disease, but we all should have in the back of our minds those symptoms in case they occur, and contact your doctor if they do. There is vaccine against meningococcal disease, and it's always good to check you're up to date and your child is up to date with those vaccines against meningococcal disease.
Thank you, Dr. Jeremy. Is this only common to young children, or is it also common to adults?
Yeah, look, people of any age can get meningococcal disease. However, it is more common, as I said, in winter and early spring, but it can occur throughout the year. But it tends to occur more in little kids, so babies, kids under 5, and then in young adults and adolescents. So the highest risks we see are in people in their 20s, late teenagers, and then small babies. So it's important to be aware of those symptoms and seek medical care early.
And what should baby be doing if you do have meningococcal? What conditions? How do you protect yourself at home or and other people around you in your family?
Well, it's one of those diseases that's hard to, prevent the transmission, because transmission's actually quite hard. So you really need household-like contact. So living with somebody tends to be the biggest risk, but you can occasionally pass it on to other people, often through deep kissing or very intimate contact or household-like contact. So awareness of the symptoms is important, but vaccination, as I said, we used to have over 200 cases a year in New South Wales back in around 20 years ago, but with vaccines being brought in the early 2000s and more recently, those numbers have really declined. But the vaccine isn't perfect, and so even if you have been vaccinated or if your child has been vaccinated, just keep in the back of your mind those symptoms, and if those symptoms occur, seek urgent medical attention.
Thank you, Dr. Jeremy. Dr. Jan, the masks, you just mentioned that from today, masks from in transport and some public places are not needed, but it is important when you go to hospitals, and because of these illnesses that are still around, it's important to still wear the mask.
Absolutely. So you still should be wearing your mask if you're going to a public hospital. You should be wearing a mask if you're going into a private hospital. You should be wearing your mask if you're going into an aged care facility. There are particular places where people who are much more likely to be vulnerable to severe illness are. You'd also think about that in other circumstances. So say you were going to an afternoon tea with a lot of elderly people, you couldn't wear it while you're having the afternoon tea, but the rest of the time wearing a mask may reduce the risk that if you're brewing something, passing it on to somebody else whose immune system may not be as strong as yours or who may be unwell. I think the other thing to really remember is we can't tell who around us is vulnerable just by seeing who's walking past us. And so again, if we're unwell, we really should still get tested and stay home until we're well to reduce that risk. We shouldn't just put a mask on and hope that that's enough. We really should just stay away from other people and make sure that we look after ourselves as well, give our bodies time to heal.
Thank you, Dr. Jan. Please ask your questions on the chat and we'll make sure we'll have our experts answer them for you to share with your community. Dr. Jeremy, there are some symptoms, I'm reading here, meningococcal, there are some symptoms that are quite common to the flu as well as COVID.
Yeah, it's quite hard with any disease to be to know exactly sure what you're dealing with, and so if you, but with meningococcal disease, it tends to be a sudden onset, and people tend to be quite unwell with those symptoms I mentioned earlier. But children, young children particularly, may not have all the classic symptoms. They might be irritable, difficult feeding. They may not be able to express themselves. Of course, they might have a high-pitched cry. So if you sense something's just not right, then contact your doctor. And most of the time, the doctor will be able to say, "Look, that's something else." There are lots of other conditions that cause rash, but you want to be safe rather than sorry. I should also mention measles, which we're concerned about as well. A few weeks ago, WHO reported that because of the pandemic and people not getting out and about, a lot of children, millions of children around the world just weren't getting their childhood vaccines. And so there's a lot of under-immunisation around the world from, a range of common vaccines like measles, mumps, rubella, polio. And so that, for us all as global citizens, means that there's an increased risk of some of these diseases re-emerging now that people are travelling again. If we don't have high rates of vaccination around the world, it means we're all kind of susceptible. We hadn't seen any cases of measles during the pandemic with not much travel about. But in the last couple of weeks, we've seen our first case of measles in New South Wales since the pandemic. Now, measles, people will think, well, it's just a childhood disease, but it can be really serious. It can be fatal in some people. It can be, in about a third of cases of measles, can lead to complications like pneumonia, ear infection, and often requiring hospitalisation. So measles, it's important to make sure you're vaccinated. The vaccine is very effective. It's 99% effective if you have the 2 doses. But if the symptoms occur, then we can see outbreaks rapidly spreading. So measles is one of the most highly infectious diseases there is. And so if we get one case then we're worried there'll be transmission in the community. We know that some communities haven't had the opportunity to get vaccinated, particularly some communities who've moved into Australia from areas of the Pacific or other countries where immunisation programs weren't as good for children. And we know that in Australia, people born before around 1965 are at increase, will have had measles naturally. So people born after 1965, if they haven't had 2 doses of vaccine, they're maybe at risk for measles. So all of us should check if we're born after 1965 or were born in countries where there weren't good immunisation programs available when you were children. Check you've had 2 doses of measles vaccine. If you haven't, there's no harm in having additional vaccines, and it can help you and your family and community avoiding outbreaks, which in some cases can be really big, these outbreaks.
Thank you, Dr. Jeremy. We've talked about vaccination for many years, and people are now more aware of that. So if diseases, meningococcal, measles, and JEV, and of course COVID, vaccination is top of mind, but it's also a lot of people are still in fear, are wary about getting vaccinated. And what's your advice for that?
Gee, vaccine is just such a gift that we've got from modern science, and it is rigorously tested before available for the general community. There are so many standards in place to make sure that the vaccines we use are safe and they're effective. If you talk to people who have lived through polio epidemics or, years back, even smallpox when that was a thing, there's no question in their minds that vaccines are a saviour of humankind. And with the COVID pandemic, we saw really rapid development of these life-saving vaccines that have really got us out of the worst of the pandemic. So look, the science is clear, vaccines work really effectively. What we do know, that people are getting fatigued and people are tired after the pandemic and having to have vaccines, but just remember they're so important for keeping us well. And for COVID vaccine, we know that it's not as good at preventing transmission as we would like, but it still prevents severe disease. So it's really important we're keeping up to date with all our vaccines, COVID, measles, mumps, rubella, and so on. Now, I might mention also polio has been an issue in some parts of the world. In London and New York have seen evidence of polio, and polio is one of those diseases we're hoping to eradicate from the world, but it's stubbornly remaining in some countries. And now and then we see travellers coming back from high-risk countries, particularly Pakistan, Afghanistan, and places where they haven't eradicated polio, which means that we can see spread rapidly around the world. So in London, New York, there's a lot of concern there might be spread of polio. So similarly, we're concerned in Australia that we could see, with all those children not being vaccinated, I mentioned earlier, we could see outbreaks of these diseases like polio again. So important, particularly if you're going to be travelling overseas, just check you're up to date with all your vaccines, measles, mumps, rubella, polio, tetanus. Use it as an opportunity to check you and your family are safe with the vaccines.
Thank you, Dr. Jeremy. And Dr. Jan, we've had this discussion about travel and how important it is to get information from your GP if you're traveling from overseas, when you come back, and when you plan to travel.
Yeah, and remembering that a lot of people don't even think about going home to their family or friends overseas as actually traveling. And so it is just really important that when we leave Australia, whether we're going home, whether we're visiting new and exciting places, that we really do make sure that we're prepared. We've talked to our GP, we've got our medicines ready, because we've got to be careful about how we carry our medicines. Some of them need refrigeration. We've got to be careful to make sure that we've got a doctor's letter with us, because some medicines that are freely available in Australia can have problems for you taking them into other countries. And of course, making sure that we've got our vaccinations up to date. And that includes our kids, particularly for gastrointestinal issues, because sometimes things that, you know, we grew up with that were no problems to us because that was where we were, when our kids meet them for the first time, it could be really nasty. So there are vaccines available for things like cholera, typhoid, that can really make a huge difference to our kids' health and their enjoyment of being with family and friends away from Australia.
Thank you, Dr. Jan. And Dr. Jeremy, it is a time to think about it because school holidays are coming up. So it's parents should be thinking about getting to their GPs and discussing it with their GPs.
Exactly right. So, you know, I guess when you're planning a travel, just check that you use it as an opportunity to check your vaccines are all up to date. You can do that easily through the Australian Immunisation Registry. You just Google that, you'll find evidence of that, and you can look up whether you're up to date, or more easily talk to your GP. So it's important that we use that as a travel as a reminder to check we're up to date. It's so important now. We're seeing this potential for outbreaks around the world with vaccine preventable diseases.
A lot of the cases and a lot of the stories that we've heard from people who've had COVID for a long time, they're fearing that they might have worse symptoms, and some have very luckily had mild symptoms. And so these diseases are important to be, you know, people should be reminded that it could be high risk at some point.
Yeah, you know, COVID we know comes in waves, and no doubt there'll be future waves of COVID. At the moment, we're in a very fortunate position where we're over one wave, and we're hoping that the cases will remain low. But I think everybody believes there'll be another mutation down the track, and we'll see further cases. And you know, vaccines against COVID last a certain amount of time and then start to wear off, and so we all become more at risk as our vaccine immunity or natural immunity from infection wears off. So we've got to be mindful and keep up to date with the latest recommendations about what vaccines you need for COVID. But similarly, while measles vaccine is very long-term, some other vaccines like whooping cough vaccine, you know, you have to get boosters at certain times, tetanus vaccine. So it's important we kind of regularly check in with our doctors, with when we're due for our next shots. And there's on our website, we've got a table of what age you are and what vaccines you need that people might find useful.
Thank you. And that's on the chat. Please, if you have any questions, please add them to the chat. And I think this is really important to share on your publications and for your communities. Dr. Jeremy, there are other, aside from all these, you know, whooping cough, you mentioned measles, meningococcal, there is the Japanese encephalitis, which we had earlier on this year, but there is that possibility, and most likely it'll be coming because of the season.
Yeah, people may not realize, so Australia was free of Japanese encephalitis until earlier this year. So Japanese encephalitis is an infection that's quite common in parts of Asia and was seen some years ago right on the Torres Strait in very far north Queensland, but had never been recognised in New South Wales or parts of the southern states until earlier this year. Now, Japanese encephalitis is a nasty infection. For some people, most people who get infected get no symptoms, but a proportion will get very nasty disease, neurological disease, affecting the brain or other parts of the body, and some people can die or have long-term consequences. But fortunately, that's a small percentage of all those who get infected. Now, how it's spread is through mosquitoes. So what likely happened is the mosquitoes that naturally carry Japanese encephalitis in parts of Asia may have, through climate change or some sort of change in the climate with wetter seasons, likely came down with wild birds into southern Australia, infecting, and the wild birds then infected the mosquitoes when they fed on them, and then mosquitoes then bit pigs, and pigs can carry the infection for a short period, and also infect people from the mosquitoes, not from the pigs. So mosquito bites spread the transmission. And we've done recent surveys taking blood from people who live in Western and Southern New South Wales and found that a proportion of those people have 1 in 11, in fact, had evidence of infection with Japanese encephalitis. So it's we don't know what's going to happen this season. The season of mosquitoes tends to be summer, over Christmas and into the new year and into autumn. So we're concerned that we'll see another, but in wintertime, I should have said that when it's colder, the mosquitoes in New South Wales at least tend to go away or be not so frequent. So we haven't seen cases over winter, but we did see them in the early part of February of this year. We're worried that there'll be further cases as the weather warms up, mosquito activity increases, and people are bitten by mosquitoes in Western New South Wales and Southern New South Wales. So the message, there are a range of other infections that are carried by mosquitoes in New South Wales, Ross River fever, Murray Valley encephalitis, that can be quite nasty. So the message is we all need to be careful not to be bitten by mosquitoes because A, it's unpleasant, but B, they might carry infections. So the simple measures like wearing insect repellent, covering with your body with long sleeves and long pants, avoiding times when mosquitoes are most prevalent, such as dusk and dawn, and making sure you've got screens to protect against mosquitoes around your house is really important. But now for certain people at higher risk in certain parts along the rivers in Western New South Wales, we're offering free Japanese encephalitis vaccine to people aged over 50 who live in certain LGAs. That will be on our website as well for people to check out. But it's important to avoid mosquito bites. And if you're in those eligible areas over 50, please, and have a lot of outdoor activity, please check in and get a vaccine if you're eligible.
And again, check in with your doctor, as you said. And there are resources on the New South Wales Health website and also in language resources on the Multicultural Health Communication Service website. But one of the things, Dr. Jan, is that hearing us today, there are so many medical matters that we've been discussing. How do we make sure that people aren't fatigued or get scared? And I think these are conversations that's important to be able to maneuver with your families as well.
Look, I think it's really difficult, but I think one thing COVID's done is it's really connected us to our health. It's made us think about, do I have chronic medical conditions? What's my immune system like? Am I on medicines that affect my immune system? And how might that impact where I choose to travel, what I choose to do, whether I choose to wear a mask or not? So I think it's put us back in touch with our bodies again in a way that not all of us really enjoy. But I think the key thing is that some of us may have dropped out of regular healthy habits that we had before the pandemic. So I'm not just talking about exercise. I'm not just talking about diet, as important as those are, but things like making sure that if we've got a strong family history of diabetes, checking in with our GPs to make sure that we get diabetes screening done, checking in if we've on heart medications or blood pressure medications to make sure that the medication regime for us is optimal, checking in about and making sure that we're up to date with screening, as we've been speaking about in recent weeks. I think it's really important that what we're doing is not just thinking about communicable diseases and making sure that we're ready and prepared so that we've got all of our vaccinations up to date, especially if, we might be thinking about having a family, getting up to date with our measles, mumps, rubella vaccine, because they can wear off, as Dr. McAnulty said. But also all those other things that go into helping us sort of keep moving forward in a healthy way so that, we can spend a much longer time with our family and friends doing what we like doing.
Dr. McAnulty, any comments to add to that? I mean, even, how we start these conversations and making sure that we're not scaring people and knowing that it's just, these are important messages.
Yeah, look, we live in Australia and we're very lucky. We've got a wealthy community compared to many other parts of the world. We've got high rates of vaccination. I guess we want to maintain those high rates of vaccine. In the face of all this information that's coming out, people can get confused. But our website and your doctor are a great source, and your pharmacist are great sources of information to help guide you through what some of the useful things you can do routinely, as Dr. Jan says, to keep yourself healthy, to get those screening tests, and just check you're up to date with those immunisations. But, bear in mind, some of these, I've talked about measles and meningococcal disease. Fortunately, they're relatively rare, but having this information in the back of your mind is important so that if you do get those symptoms, you think, call ahead to your doctor before you go so you don't go infecting other people in the waiting room if you do have measles. But checking in with your doctor to see, what the diagnosis might be.
Thank you. And Dr. Jeremy, health protection, New South Wales, keeping you very busy, isn't it? Can you tell us about, what you do and what the experts are doing to keep data and how evidence is important to making sure that communities are safe?
Yeah, I work in a section called Health Protection New South Wales, which is part of the New South Wales Ministry of Health. And part of our job is looking out for what diseases are tracking in the community, such as measles and meningococcal disease and COVID, and a range of other diseases, to understand who's most at risk and how we can intervene through sort of activity, communicating to those people most at risk, providing vaccination, working with doctors and others, pharmacists, to make sure that vaccines are delivered effectively to people at risk, providing good information, accurate information to people so they know what the risks and benefits of various diseases and interventions might be. And that whole system relies on the goodwill of the community, the importance of doctors and laboratories notifying conditions to us so we can track diseases. And, this sort of communication that the multicultural media do is so important in informing the community. We know that communication is just so important, so people are armed with the right information.
Dr. Jan, World Health Organization, as you mentioned, it's key for us to be in touch with what's happening around the world and knowing that the information here is crucial for communities to be sharing.
Look, and I think that's one of the things that New South Wales has done very, very well. We're very good at seeing what's happening overseas and starting to plan for what if that comes here, and taking information from overseas, looking at whether it's relevant to the New South Wales community and then adapting it. I think we have to really understand that health systems around the world are quite different and have got different capacity for responding to different things. And we're very blessed here in New South Wales that, we have, of course, people who have a very difficult time at times navigating our healthcare system. Generally, the standard of care available to people is very, very high. And that way we can be assured that, if there's a new medicine that's going to help people, if there's a new surgery that can help people, if there's a new whatever that can help people, there are experts here in New South Wales who are doing their best to stay on top of the latest, but also look at the evidence behind using some of those new interventions to make sure that what we're doing is as safe and appropriate as possible.
Thank you, Dr. Jan. I think we heard a question today, and we'd like to ask the question. They're saying that because of the masks, does this mean that COVID is almost over? And should we be not worried anymore? So is that an indication?
No, I think it just means we're reaching a different phase of our response. As Dr. Jan said, masks continue to have a role in terms of, they work in terms of preventing transmission both to people and from people with COVID, and for other conditions. So I think one thing that we learned in COVID, I guess, is the importance of masks as a long-term strategy. Now, that just because they're not mandatory doesn't mean they're not useful. And as we've talked earlier about, COVID is going to continue to be with us probably forever. It'll mutate, it'll change. Hopefully mutations will mean it'll get less severe, but we just don't know. There might be a new mutation that makes it more severe and more transmissible. We don't know, but we, I guess, need to, as a community, adapt and, hear the messages that the experts are telling us about what we can do to prevent infection. So those little things that people talk about, wearing a mask where you can't distance or from other people or in crowded situations, I do it still, even though it's not mandatory. Make sure you stay at home. If you've got symptoms, get a test. If you've COVID, if you've got the symptoms of COVID, good old-fashioned hand hygiene is really important. So using either the alcohol hand rub or washing hands with soap and water for 20 seconds just gets rid of lots of germs. And, you know, importantly, getting vaccinated, as we talked about earlier. And, you know, ventilation is important for a range of diseases, you know, tuberculosis, COVID, influenza. So do things in well-ventilated areas, ideally outside when you can. The weather's beautiful at the moment, except it's going to rain this week, but it has been beautiful. So, you know, enjoy the outdoor, and that has good effects too.
Yes, and be wary about mosquitoes, and if there is any, and also just making sure that you wash your, as you mentioned, just following those rules that we've, well, not rules, but habits that we've formed, isn't it? We have run out of time. Thank you very much. We had a question from Boshra, and we have given you the question, the updates in COVID-19, and Dr. Jan was able to give updates on COVID-19 and the hospitalization numbers. But I'd like to pass it on to Dr. Jan for any last words before we go, and then to Dr. Jeremy.
So I think the key thing is that as much as we'd like COVID to have gone away, and as much as we're excited, I think, to sort of say we're getting to a much better place as a community, those little things will still be important in the coming weeks, particularly on school holidays as we move and mix in ways that we don't normally. We're moving into new social groups and so on. So do take your masks with you on holidays. Do make sure that you've got your RAT test that you take with you for school holidays so that you can test yourself if you're not feeling great. Testing clinics throughout New South Wales are available on the New South Wales Health website. So of course you can check and see if there's a clinic open locally if you need a PCR. And do take care of yourselves and have a great break if you're going on a school holiday break.
Thank you so much, Dr. Jan. Dr. McAnulty, thanks so much for joining us. Any last words on measles and meningococcal and all the other diseases that we should be taking care of ourselves about?
I think check your children are vaccinated, up to date, and that yourself is up to date. Easy to do, but easy to forget. So do it now.
Thank you so much, Dr. Jan and Dr. McAnulty, for joining us for these sessions, and we hope to see you again in the next fortnight. We also have the recording of this session to share with your community and on your publications and broadcasts, and we'll send them on the link. We're also available on the Multicultural Health Communication Service website. We'll be back, as I said, in the fortnight on October 5th, and that month, October, will be Mental Health Month, so we hope to tackle some issues on mental health and well-being and share some resources with you. Thanks for joining us again. Have a good afternoon and stay safe.